Well, I'm Kim Azzarelli. I'm the CEO of Seneca Women, and I'm here at the Media Lab as a Director's Fellow, and I'm delighted to be here today to moderate this very exciting panel on AI's impact on global healthcare delivery. You have some unbelievable speakers here. We're going to start with a very short video. Let's see how this goes.
Healthcare remains a significant challenge around the world, with half the planet's population lacking access to adequate medical care. Yet the technology and resources are there. The US alone donates more than $250 million and thousands of physician hours annually to short-term medical missions. But significant inefficiencies exist, causing unnecessary suffering. We believe this is a solvable problem, and that we can learn from models like the world's financial markets, which utilize big data real-time to facilitate the flow of capital. What if we could leverage technology to better match needs and resources and reduce the inefficiencies in the delivery of healthcare? What if we could use big data to make the invisible visible and see where the need is greatest, and then deploy those resources where they'll do the most good? We believe this is possible. The Virtue Foundation Data Mapping Initiative is a new tool that pulls data from myriad sources such as social media, detecting patterns through natural language processing, satellite mapping providing geospatial data on infrastructure, including roads and building heights, and then uses machine learning algorithms to deliver predictive analytics that match volunteers with the places, the projects, the patients that have the most need and can most benefit from their skills. Volunteers can use this technology to search for their specialty and indicate their preferences, and then learn where they will have the most impact. The result? Countless data points analyzed, thousands of doctors deployed, millions of lives impacted.
So now you see why we're so excited to be here together with some incredible leaders in healthcare and AI. I'm going to start with Karim, and we're going to talk about the US market for a minute, and then we'll move into the global health space. Karim, you started Mendel AI. Can you tell me a little bit about the company and how you got it started? Okay.
So my background is medicine, and as a physician, it was very obvious that we are drowning in data, but we are hungry for insights. You can't tell what happened to all Asian females under the age of 50 who have taken a certain drug, even though we have insane amount of medical records. So Mendel essentially is a company that solves that, and we're able to generate insights from clinical data. And what makes us different is we've built an AI that have clinical common sense. It knows when fatigue is a symptom. It also tells when fatigue is a side effect. Sometimes in the same document, the same word is in completely two different contexts. So things that we would replace are armies of nurses doing manual abstraction of records, like manually trying to read records. We're able to read those records through an AI system, and we can do that at scale. We also replace the armies of data engineers who have to architect a query to find something in the clinical records. We allow the doctors and other stakeholders in the healthcare to essentially chat with the medical record and kind of ask questions and get answers of it. Some of our clients, we have a client that big diagnostic company, they have insane amount of data. They want to figure out how many colon cancer patients that tested positive last year. That took them 2 months. They found 10,000 patients. Using a system like ours, it can take you a day, and we found only 2,000 patients.
Wow.
But we were right, they were not. And essentially, that's what we bring into the table. It's faster, and it's more accurate than the standard analytics that we have today.
I mean, it's a super exciting time to be in healthcare and AI, and to be in this moment where you can actually see what's about to unveil itself. And what you're doing, from what I understand, maybe you can give us a use case around oncology. I understand that you're creating a pretty specialized vertical in an ontology that can help, as you mentioned, researchers, physicians, better understand cancer research. Tell us about the cancer case.
A lot of the existing solutions today rely on an LLM approach, which is something that we also do, but it's like going to Home Depot and getting a hammer and saying, I'm going to build a building with this hammer. It's a tool. It's just one thing in your toolkit, but it's not the only thing that you should have. And when you come to, and usually the way I always like to think of LLMs, it's like a parrot. It learns from the data, so it is able to like kind of, it makes you confuse fluency with intelligence. It's a very fluent system that doesn't necessarily understand why things are in that order. So what we have done in Mendel is we essentially use LLMs, but we layer on top of it a knowledge base. This knowledge base knows you will never get a headache in your knees. You cannot have a patient who's metastatic, but at the same time is a stage 1 type of a cancer. So it has all this kind of rules, I would say rules, but all those kind of grounding logic that sits on top of the LLM and allows it to steer the LLM to better context. One big challenge is medicine is too complex to be abstracted in rules. So what we have done is we created what we like to call a generative ontology. So think of us using LLMs to actually scale those type of knowledge graphs and those type of logic, and then have humans review and say, yeah, that sounds like right, this doesn't sound like right. So it's not really a rule-based system, but a scalable knowledge graph that essentially have logic into it and grounds the output of the LLM, and that's what we call a hypergraph, essentially.
Fantastic. Yeah, and it seems from everything that we're doing, and I think a lot of the people on this stage will talk about, that is certainly the only way forward in healthcare. So amazing. And a little bit more on the cancer side. So you've kind of mapped the biomarkers, you've mapped the therapeutics, you kind of got the full knowledge base, probably sort of some sort of RAG system, and you've kind of owned that space in terms of the knowledge.
So it's not a RAG system. It's actually the approach is almost opposite to RAG in some fashion. So if you take something like as simple as triple negative, like a patient has a triple negative ductal carcinoma, which essentially is a breast cancer patient who have 3 biomarkers tested negative, as negative. It's a very confusing thing for a lot of LLMs because how many things are negative that are mentioned in the record? Insane, right? Many things can be negative in a health record. So what that is doing essentially is mapping out even processing the record that when ductal carcinoma is mentioned with triple negative, essentially it's ER, PR type of biomarkers being tested negative. So it's more of an explicit logic rather than inferred logic that sits on top of the inferences that are happening on the LLM side.
Amazing. We're super happy that you're doing this, and I know cancer patients, I have a background in breast cancer, so really appreciate what you're doing. Joan runs transformation for Boston Children's Hospital, really, as John Warner just said, one of the stars of Boston and leading in this space and the intersection of AI and healthcare. And she also straddles the global health area. She co-founded Virtue Foundation, which I think you saw that incredible video, and has been working in this space for 10 years, trying to think about how to use data science for good. So Joan, tell us a little bit about what you've been doing. What's the problem that you're trying to solve in global health?
The main problem we're trying to solve in global health is the matching of resources and need, as you saw in the video. I'll give an example. There's 143 million people every year in low and middle income countries who do not receive necessary surgeries. And there are many people like me who are a part of these medical expeditions going to low and middle income countries, delivering care and transferring knowledge. And there is a market dynamics issue. How do you get the people with the skill set, the specialized skill set, to the people and places that need it most? And as my colleague, Dr. Elahi, who's in the video, rightly says, it's a lemon market. There's this complete mismatch. Those who most need it can't make their needs known. They're maybe barely off the grid. And those who can go, there's tremendous frictions to the going. So we've been using AI to try to make that easier. I think the other interesting piece as we've been building out this ecosystem, this marketplace, is that governments in low and middle income countries and hospitals in low and middle income countries are very eager to work with us, because if there's somebody who's a data scientist with AI capabilities in their country, they're being hired by financial institutions. So they also can't build these capabilities easily. So we're also partnering with the governments on the ground.
So I don't know how much time we have to get into this, but I think what's amazing to me in sort of being part of the project for these years is that you've been thinking about machine learning and AI in this way for many, many years.
Yeah.
We have some incredible partners on the stage with us, and we'll talk to them as well about how you've been building this. But, what's ultimately the goal? I mean, the goal is to match, as you said, to reduce the friction, to make sure that doctors, medical volunteers, surgeons, doctors like yourself can go to the right place at the right time with the right skills. Why can't people just show up today and find that on the internet, or why can't they just go to the World Bank?
Well, we asked that question, and we went to those institutions. We're have special consultative status to the UN. Thought, oh, there must be a data set somewhere, and there really isn't. And we really worked to use machine learning to create the first foundational data set of healthcare NGOs and healthcare facilities, and we've mapped this across 72 low and middle income countries. Which we have built this data set. We published it with Taylor and Francis. We were able to use COVID, published the first edition in 2020, the second in 2021, and have been building out a web-based platform so that this can be used not just by us in the foundation, but it can be used by all actors in the global health space, whether it's a clinician such as myself who wants to go and wants to know where I should go with precision with my skill set. But also, like I said, low and middle income country governments, other organizations can use and leverage this data set.
So it's an unbelievable thing because it's a fully philanthropic project. Anybody can use it. The idea is to reduce the friction in the marketplace for global healthcare delivery. And you've brought some incredible partners to the table. I know we could not have done it alone at Virtue Foundation. Tell us about how you got from the book to these incredible maps that identify medical deserts and the role of our partners on the stage.
Sure. So our first goal was to create the foundational data set, which didn't exist, and then couple that with other layers of data to first identify the medical deserts. Where are these locations where there's large populations of people without access to care? And we mapped it not just like general medicine. If I have a cataract, I need an ophthalmologist. If I'm about to deliver a baby and I'm failing to progress in labor, I need somebody who can do a C-section. So you need to know what facility to go to, which one has what capabilities. And we have built out our data set, and now using Gen AI to enrich it further, to have this very granular data for each healthcare facility and healthcare NGO. And we've networked who's working where. And then we can couple that with other layers of data, nightlight data, solar data, land data, you name it. And you can start seeing things. I think it showed in the video, computer vision. You can use multimodal data to start to understand what's really happening on the ground. And this is just one kind of schematic of maps, but you can look at the green areas that light up is where there is actually access to healthcare facilities with capabilities. But we've done those maps for ophthalmology, for cardiovascular disease, for every specialty that exists. So you can see where the deserts are. And we've looked at it from different lenses, both zonal statistics, the way a politician may look at it, quad-tree analysis, so you can look at where are those large areas without access to care. And then I think if you can carry on to the next slide, I think Data Robot's been a tremendous partner in getting us to all of this work. But you can see where is, this is some of the work we've done on identifying optimal locations, coupling multimodal AI to be able to identify where should the next healthcare facility be built? Where should the next specialty go within a particular facility anywhere in the country? And then we can optimize around that for impact.
It's amazing. It's honestly, everybody in this room wants to be part of this project because when you see the possibilities, two important use cases, and then I'd love to have Chandler jump in. Two important use cases that have been very exciting is, as you mentioned, where do you build the next healthcare facility? So there's a surgeon at Sinai who's really come up with a really amazing ambulatory surgical care center that he can stand up anywhere in the world for a small amount of money. But the question is, where can you have the biggest impact in putting up that surgical care center? Or another project we're working on is, where do you put tricycle ambulances to make sure that you're getting the most optimal access to the nearest healthcare facility? And that's of great importance. To me, it's a lot of maternal mortality happens because of lack of access. So Chandler, you have been at the center of this. DataRobot has been an incredible partner. Tell us a little bit about DataRobot and sort of why you got involved in this. And you actually are the architect of Data for Good at DataRobot. So tell us a little bit about that.
Sure thing. So at DataRobot, we're an enterprise AI company, and what we do in a nutshell is enable data scientists and companies to rapidly build, operate, and govern AI solutions at scale and in a confident manner, right? So ultimately,
Can you increase the volume for him? Sorry. We want to hear everything he has to say.
Thank you for being my advocate. So we launched the AI for Good program at DataRobot because we wanted to understand and help and say, how can we provide these cutting-edge resources to mission-driven organizations who may not have the resources to get it themselves, or also the data science team, like Joan was mentioning, to tackle these by themselves. So we started working in 2019 together, and to solve to help solve what Virtue Foundation is trying to do. There's a couple of really important questions. First is, where are the facilities, right? And that's the first thing we tackled. How do we take the web scrape data and go from human labeling to automated classification, saving thousands of hours, to know where things are? And then that raises another question, or it allows you to answer another one: where should they be that they're not, right? And how do we get down to the specialty? So that's where we're able to incorporate some of these novel techniques to understand where should care facilities be by specialty that they're not. And then also we have to think about, how do we rank that and prioritize that, because there's limited resources. So it's been an incredible journey along the way, and we're excited to keep participating. Yeah.
Well, we've witnessed firsthand the value of having that kind of partnership, and I know that Virtue Foundation was one of the first Data for Good partners, which brings me to Rob from Databricks. Rob joined the team about a year ago now, and of course you all know about the incredible acceleration of Databricks over the last several years, and we're so pleased that you're a part of this now as well. Tell us a little bit about Databricks and why you joined this incredible team. And it's really fun to have multiple data science companies working together for good. It's a real testament to what's possible. So tell us a little bit about that.
I don't know if you know the origin story of Databricks, but it began with some PhD students on a college campus, not too dissimilar than this one, just maybe on the other side of the country. A focus on building a product, open source, on public cloud. And those two things are important for, I think, the spirit and future of the company. When I think about, Malik, your hammer at Home Depot, Databricks is working on democratizing the tools and capabilities around data and AI. And so whereas maybe a year ago your hammer costs $100 million, maybe now it's $10 million. And not only that, with Databricks you can actually get instructions on how to use the hammer in a particular fashion. So for me, Databricks is important to me as a person because of the democratization of the tools around data and AI. And that allows things like efforts like the Virtue Foundation to get more things done in a lower cost, yet more a deeper and more impactful fashion. So
yeah, I mean, what I find amazing about this suite of people you have, which I think is a pretty unique set. It's a unique moment for healthcare. It's a unique moment for AI, but sort of taking the intention, as Joan would say, to really apply it to good and solving very important problems. I mean, how can the people in the room get involved at this moment in healthcare? What would you suggest?
I think there's a couple of things. One is, and I think you've mentioned that, like the really good talent in AI tend to go away from healthcare. Healthcare is not famous for getting the best talent for multiple reasons. It's a very conservative industry. We don't pay as much as a Google would pay, for example. So you find a lot of the talent moving to different areas, different domains. And at the end of the day, I think models, data, all those are great. But in this AI era, it's all about the talent. It's like those three people can change the course of a company. And we're not talking about numbers game, but more of like how good they are. And attracting them to healthcare is a two-way street. One is like, there should be openness from the talent side, but there's also should be type of a pitch from the companies on here's the value, here's what you would do if you join a company like this. But I think attracting the right talent to healthcare is going to be important because I would say there's a lot of situations, and it's very unfortunate. As I said, my background is medicine, but I was fortunate enough in the last 5 years to know enough about AI where I would say like I have enough domain knowledge in that area too. And I see many occasions where the blind is leading the blind in healthcare when it comes to AI. That's a really big problem.
That's scary.
So yeah, getting talent.
Let's try to solve for
is one
that.
big thing. Yeah.
Well, I know these two companies, and maybe Joan, you can speak to this a little bit. I mean, the tools that they're putting at the disposal of the healthcare system, and maybe I can even direct the question to Chandler in a minute, but Joan, I think you're seeing firsthand from your role at Boston Children's and also from your role of running this game-changing initiative, having access to tools that they're providing kind of are the game changer for healthcare. Tell us a little bit about that.
Yeah, absolutely. I think things are changing so quickly, and I'm very lucky to also be in this MIT ecosystem. So I'm able to see what's coming tomorrow or this afternoon even. It's crazy the speed at which things are accelerating. Within our own individual team, kind of to Karim's point, how much data science talent can we hire within an NGO? I mean, we do have a data science team because
And he's quite good. They're quite good, both of them.
they're phenomenal, but it's because they have this mission-driven element and really want to help. But I think what we've been able to do, we want to build this enterprise grade, so it's really used as opposed to just an academic effort. And it's the partnerships that allow us to build this enterprise grade, and that we're plugged into the cutting edge, leading enterprise grade and AI concepts. So we're being able to integrate it real time as it's coming live.
Chandler, tell us a little bit about enterprise grade, because that's a really important point.
Yeah, I mean, ultimately, when you're dealing with use cases like this, or in use cases in the provider system or in pharma, I mean, you're talking about informing decisions that matter and they're high risk. So you have to have solutions that you trust, right? And so I think the ways people can get involved at the practitioner level is learning to use the tools like Rob and I were mentioning, where you can help, you can 10x yourself as a data scientist, right? At the leader level, though, I think it's advocating for the use of technology and also understanding it enough so you can communicate that to stakeholders. Like I know your work in Ghana and Mongolia, you've had to share the results of these, and I'm sure that was met with some curiosity when they saw the impact of what you're proposing, right?
Yes.
Yeah.
I can give a perfect example. Last year, I was in Mongolia meeting with the Minister of Health and showing him the optimization work we'd done with Data Robot. And it was supposed to be a half-hour meeting. It was an hour and a half to 2 hours later that he was still there. And he's like, 60% of my children don't have access to dental care, and you could tell me where I should put it. I was like, yes, we could do that, and we can do it in about an afternoon, because it's all structured and ready to go within an enterprise solution. So I think that's the game changer.
Now, Rob, you have a very important role at Databricks in the sense that you are in communication with the next generation of data scientists, helping to fund university programs. Tell us about how we get more folks recruited to do data for good and why that's important.
It's really interesting I'm a person of a certain age at a company with people of a certain younger age. So when I go into work, it's like, it's an injection of optimism and energy that's hugely important. And the exciting part about my role is connecting the young folks who are beginning to know their power. I'm a fantastic data scientist. I'm doing amazing things, maybe in the financial realm. But wait, now I know the Virtue Foundation. Now I can take that power and apply it to a purpose and connect with other people who are also engaged and excited about it. So to your point about the talent, it's not that now we have to hire them. Now we get little timeshares of that youthful, optimistic, brilliant talent. And that to me is the magic of all of this. It's the connections and the people who are finding a purpose for the work that they've put so much time and effort into. And it's hard to watch that without tearing up. It's just hey, how could you not be involved with something like this? Help the dentists in Mongolia. It's fantastic.
I do know that, Virtue Foundation is driven by the motto, one person at a time, one act at a time. And we all on this stage are heavily driven by purpose, connecting together to solve this major problem. I know we're running out of time, and I'm sure she's wanting me to get off this stage. I'll just stay. But quite seriously, we'd love for anybody in the room to get involved in this project. All of us are using our time, our resources. Joan, if there's anything you want to say about how people can get involved in Virtue Foundation to solve this very significant problem.
Yes, definitely. I think there's a QR code if you
Yes, there
move
is.
it forward from our partners. Parto also is a partner in this. We have stand-up meetings with all of these companies weekly, which is phenomenal. This can give you more information about Virtue Foundation and the global health marketplace. My email is there. Please reach out. We are always looking for others to connect and be part of this incredible mission to bring healthcare to millions of people that don't have access to it.
So whether you're a funder and you want to fund an interesting project, whether you're a company, whether you're a data scientist, or whether you have other skills, I'm none of the above. We can all volunteer to make this a reality, and that's what it's going to take. And we're really close, so please join us. And of course, keep an eye on him and what's going on. I mean, I think if you're a company in this room and you're looking for a stack in the healthcare space, you got to check out what Mendel's doing. Thank you very much.